didn't feel like I was pushing, but to look on the screen, you know you are doing something.
Three, 2, 1, let's get them both up. Harder on the left, harder on the left. You're in. Hold there. Work hard, Steve. Well done. That was good. Clients like Steve and muscular dystrophy in particular, like he's wheelchair bound, but he has to transfer. He actually is using his hands and his legs, but he has to use his hips to get into his bed, get into chairs. So trying to keep up that hip strength and get him in better positions is a real world transfer there for him in particular. I've felt a bit lost with your adductors and what to give you to actually strengthen and give you that activation.
We were trying the abductor ring.
We ordered an abductor ring, just wasn't suitable for Steve. You get a bit disheartened as the clinician sometimes, what can I give this person to help?
Yeah.
So it's been nice to have ForceFrame. We can see it, we can track progress, and to give Steve something to, keep him engaged as well.
Keep going, keep going, keep going, keep going, keep going.
Training mode, it records each session. All the data just gets uploaded onto the hub right there on our laptop, especially for sharing the results, but also for our prescription moving forward. We don't always have as much time as we would like with that client, so having them on the hub is awesome. I can look back at the 6 week and go, well, that asymmetry is reduced, that time in the training zone has increased. You maybe didn't feel like you're improving, but the results don't lie. 3, 2, 1, and push out. Nice, hold there. Nice and even too. Beautiful.